The human cost of long waiting times. Russell has a debilitating bone condition and last year needed a hip replacement, but it was delayed several times and he was never told why. The 7-month wait left him frustrated with the NHS.
I think very poor communicators. If I'd been given reasons to why I'd been bumped, I'd have been a lot happier. If they'd contacted me rather than me chasing them, that would have been a lot better as well.
The government now wants to reduce numbers waiting a long time for surgery, with the priority being those who've been held up more than a year.
I don't think that's acceptable, and what we're saying today is something that shows that even when the NHS is under great pressure, we are able to make progress in bringing down waiting times, and I think that's something that patients will welcome.
More operations will be carried out to help patients who've had long waits, but that still leaves many others who are expecting surgery. The Secretary of State has admitted that a key waiting time target, that is, that at least 90% of patients should be treated within 18 weeks of being referred by a GP, will be missed over the next few months. There's been an increase over the last year in the numbers waiting more than 18 weeks for treatment in England. In May 2013, the total was just under 148,000, but in the same month this year, it was nearly 194,000, though below where it was in 2010.
The fact that this money is needed shows that there is enormous pressure on the NHS. We're running at capacity. There's a funding gap developing because investment isn't keeping up with rising demand in the NHS.
Labour claimed that having promised to protect patient care, the Prime Minister had lost control of waiting times. Hugh, BBC News.